Welcome back to another episode of An Unexpected Fight. Kelly and I are joined today again by Steve Garraty, who is the author of Grapefruit and who is also a pediatric cancer survivor. So, Kelly, tell everyone a little bit about what we're going to talk about today.
Yeah. So today we had the idea to, basically get on here, kind of a very laid back episode to just talk about how cancer, a pediatric cancer diagnosis, whether it's yourself, like Steve, who went through it, myself as a mom who has a child that's surviving, or Tiffany, who lost their child to pediatric cancer, we all kind of have a unique perspective. And we want to talk about how it impacts your day to day life, your emotional well being, your thoughts, how we kind of react to things in general, and how it's impacted us and as a whole. So I know Steve had some ideas for some talking points, and I love. So we're going to kind of use his ideas here because he has some great ones. One of the things that we want to talk about is how people respond differently to a cancer diagnosis. So, obviously, depending on whether it's your child, yourself. So, Steve, kick us off with that. What would you like to say about how people kind of just respond differently in general?
Yeah, there's probably two things that come to mind. And again, thanks for having me on the show. It's great to be here again. I would say one is for me, I had two siblings, or I do have two siblings and parents. And when I found out, each one of their reactions was very different just based on their personalities. My mother was hysterical. My father is more analytical, and I think he was processing and trying to figure out how are we going to pay for this and how are we going to get through this, and was thinking through more the kind of the tactical logical things. My brother got really emotional, which was surprising to me because we had fought a lot growing up. And then my sister was just stone cold, no reaction, and she ended up being a doctor, and I think that kind of helps her delivering bad news, but she is able to control her emotions very well. And so it's one of the first things that hit me. And literally, that was 2 seconds after we hung up with the surgeon who said, "You have cancer." And so we sat around the dining room table. And then I think I might have shared this on the last interview. I was upset because I wasn't allowed to drink alcohol anymore. And there's a backstory there. But we all had very different reactions. And then I guess the second part of that, and this is a little bit different, but for me personally, my parents wanted to know everything, what was going to happen, what type of drugs, what type of side effects. And maybe it was my age. I was 18 at the time, but it all freaked me out. I didn't want to know what was coming. I didn't want the nurse telling me what they were going to do with my vein. And like I would get queasy, dizzy, ready to pass out. And so my approach during, and not everybody's like this, but my approach going through it was like, just do what you have to do. Don't tell me what you're going to do. I don't want to know what's coming. I just want to get through this. And so those would be two things I would start with, is kind of how I managed the process and then the initial reaction.
Yeah, my husband and I had very different reactions too, and it's funny you say that. I feel like a lot of times they think of the mom as being the emotional one. I think I was the more analytical one. I was like, okay, what are we going to do next? She got stage 4 brain cancer. I was told I had 15 months. Who else can I talk to? What other doctors can I get my hands on? Let's get second, let's get third opinions. Um, I just went into like fight or flight mode. I went into fight mode. Like, let's just figure out what the next step is. Whereas my husband was planning my child's bucket list. He was dead set on like getting the Disney castle, the top like little room that you stay at, that I don't actually know who gets to stay there and how that works. I think it's only celebrities, but he was determined that we were staying in that castle, and we're not even Disney people. That's just where his mind went. Like, he was, okay, what can we do as far as like, you know, our bucket list basically. And I think that this is a very good thing to talk about, because I think, not everybody wants to hear every detail, like you said, of what's going on. I think for nurses who maybe are listening to this and oncologists who are delivering that news, I think gauging who you're talking to and asking them, how much detail do you want me to go into? Because I wanted, as a nurse, I wanted to know everything. I'm like, tell me every detail about what you're going to do. Tell me every side effect that she might experience, lay it all out there. But I could see how an 18-year-old, that's where the different perspectives come in, are like, nope, please don't tell me any of those details. Just do what you have to do. So I think this would be good for healthcare workers, and also for parents or families or kids that are going through this right now, to know that no reaction is a bad reaction. However you want to cope with it is 100% okay, because we're all different in how we, manage that. What about you, Tiffany? How did you and your husband differ?
Well, so whenever Nora got misdiagnosed in September, we were both just in okay, this is fine. She's going to be fine. Of course, in the back of my head, I'm thinking, like, is she going to live like this forever? Are kids going to make fun of her? Is she going to have some deficit that we're going to have to adjust to our perfect little baby having now, when she didn't have that before? And then as she continued to progress over the next month, before I took her back to the ER, and then I took her back, and I'm convincing myself, like trying to tell myself, this is fine. They're not really going to find anything. We're just doing all this just to make sure. And then um, in that, we ended up getting a cancer diagnosis, and I was by myself with Nora whenever I heard she's got a brain mass. Not one, but she's got three. It wasn't anything. I was in total shock. Of course, I was crying. And whenever people say you really don't know, like, how you're going to react in a situation, the first person I asked to call was my boss. I was like, I need to talk to my boss. I didn't need to talk to my husband. I didn't need to talk to my mom. I didn't need to talk to my dad. But as most of you know, I'm an oncology nurse practitioner. And so my boss is an oncologist. And so he was the first one. I was like, I need you to call him right now, because I knew that he's the only one that would know how to help me in that moment. And so that's what I did. And then, of course, I called my husband. I'm like, hey, she has a brain mass. I'm sorry, you guys. My dogs are acting like goofy babies. But anyway, hold on. Shut the door, and those big goofy dogs just push it right open. Anyway, so call my husband, and he's like, well, what is it? I'm like, we don't know. But obviously, I'm thinking to myself, like, this is bad. He's like, we don't know what it is. So he's cautiously optimistic, like, maybe this isn't actually what they think it is. And from there, of course, he's like, okay, we'll deal with this. And then, as I'm hearing about the chemo and all the treatments that they want to do, I called Jeremy, and I'm explaining, it's going to cause this and that and this and that. He's like, why are you telling me this? Is there another option? It's like, no. He's like, well, okay, then it doesn't matter, does it? I was like, well, okay. Yeah, I guess that's true. He's definitely more of a, I don't need to know the details type. And I unfortunately already knew all the details. So it was a professional hazard for me to hear all those things, but then have to sign my name on a paper saying, I know this can cause heart failure and sterility and kidney failure, or the host of other things that all of these old drugs can cause, is kind of like signing a death certificate, right? You're like, the death of whatever organ may be punished by all of the treatments that they're getting. So, yeah, we definitely had very different reactions.
And we know family can have different reactions, but Steve was talking about too, and wrote about it in his book a little bit. If you haven't read the book, it's a good one. Give it a read. His friends, like friends or outside people, let's touch on that one a little bit. How did your friends, your neighbors, your support, your community react? Because I feel like that can be a very interesting one as well.
Yeah, so I was, the book is, the theme of it is basically that for me personally, I was not in a good spot. I was a really bad teenager in my last couple of years. had wrecked cars, drinking, driving, starting to do drugs. And so cancer, ironically, ended up for me being a blessing and kind of putting me on a different path. However, when you think about friends, when you're in that kind of place, they weren't the best. A lot of them were not the best influences, not the best friends. And so when I found out, actually the day I was diagnosed, I had a big bandage on my neck, and I went to a pretty large party that one of my best friends was having. And that was also a big eye opener, because the minute you mention cancer, it's still this way today, but this was back in the 80s. Like cancer was, it was a death sentence when you heard the word. And so nobody wanted to talk about it. Nobody was comfortable talking about it. So I had this big bandage on my neck. We had all just graduated high school, and it was a huge party, and people kept, the guys would make fun of me and, call me Patch and stuff like that. But once they heard what I had, they as quickly as possible tried to exit the room and get out of that conversation. And so that was not easy when you're 18. And my social life for me was the most important thing in my life at the time, to an unhealthy point. And so, yeah, the reactions of everybody, I ended up having a couple friends I write about in the book that were just, above and beyond, and they were heroes in my story. But most of my, drinking buddies that I called friends at the time disappeared. So yeah, that was the very first night that I was diagnosed. That was a big eye opener for me from a social perspective. So it was a lonely year. I went through like 10 months, and even my two good friends, they went off to college in the fall semester. And so it's pretty much me, my parents, my brother, my sister, my nurse, who was great, I talked about last time on the show. But yeah, it was a small circle, and most people kind of disappeared at the time.
Yeah. In one way, it weeds out who your, not true friends are versus your true friends and supportive family members. I hear this a lot from people, from families, that as soon as their child's diagnosed, their friends kind of at first are, oh, I'm so sorry. Can I do anything? And then as time progresses, because some of these kids are in treatment for years, as it progresses, they back away. I think that they don't always know what to say. I can't say I personally had that experience. I've kind of always kept a relatively small, close knit friend group, and everybody in my life was very, very supportive. The only time I feel like I had an issue connecting with people was actually after she was done with treatment, and we got home, and I tried to meet up with a group of ladies from our neighborhood, and I'll never forget this. One of them was talking about how she had an awful week, and it had to do with her curtains. And I was like, I can't talk about the curtains right now because my life was just in shambles, and I almost lost my daughter. So pediatric cancer was all I thought about for so long, and it's the only thing I could really discuss and talk about. That going back into like what I want to say is the normal world, that was the only part for me that was kind of tricky. I feel like I was the one that kind of shied away from certain people because I realized that their life experiences are very different than mine, and it made it kind of hard to connect. But I did have a very supportive community, and for that I'm extremely, extremely grateful. I mean, we had neighbors who made cookies, fancy cookies, and sold them and gave us the money. We had a lot of amazing people. It just showed you how amazing some people in your life, that maybe you didn't realize how close you were to them, just how incredible they were for me personally. What about you, Tiffany?
Yeah, so I think part of the inspiration for this episode was a Facebook post that I shared, and Steve reached out and connected with me over it about just how hard all of the emotions are with a pediatric cancer diagnosis, with going through it, with myself, who is a bereaved parent, and just those back and forth of emotions. We were very well cared for and loved on by our entire community, the whole diagnosis. But over time, in the bereaved world, everybody forgets about your grief. And it's something that never goes away. Grief never goes away for me. And I'm sure for you, Kelly, like the fear that her cancer is going to come back, Steve, your fears or anxieties of all the things that you've lived through, I think are some of the harder things that a lot of people don't talk about. And like, I'm still grieving. It's been 3.5 years and I'll grieve my entire life. And the grief emotions run the gamut and they're not linear. And some days I might be angry and some days I might be sad. And some days I may be more acceptant of what's occurred. But, in a season lately, I've just been kind of angry, I guess, and wondering why did this happen to my family? Why does this have to happen to anybody's family? But, I had these two beautiful children. Some people have 6 kids. Like, why do I only get to keep one of mine? And you have all these emotions and you see people living their day-to-day life and, oh, like you were talking about, oh, I'm having an issue with my curtains. And you're like, really? Like, that's what you're going to be worried about today? And it's just hard sometimes to hear people's struggles. And that may be the hardest thing that they've ever struggled with. And I just think to myself, well, that's not fair. That is not fair that I've had to live through what I've had to live through. And now you want to complain about curtains, and I do struggle with that a lot of days. And I think a lot of people don't talk about their daily struggles of their emotions or how sometimes cancer rules your life and your thoughts, and being in this world where there's not good treatments and there's not good advancements made every day like there are in adults, it's discouraging. I think if we saw more advancements being made day to day like there are in adults, that maybe we would have a little more apathy or sympathy. I don't even know what words we'd have, but less than what we have now.
Steve, I know you talked about that in your book a little bit too, and I know you felt the why me and, just the feelings of guilt. You want to touch on that?
Yeah, I do want to just make one comment on y'all's last two comments. That year of chemo that I went through, and I think drugs have gotten better to help with the side effects, but that year was hell for me. And to this day, I always swear that as bad as it was on me, I felt like it was worse on my parents. And so definitely a lot of empathy goes out to both of y'all. I can't imagine, especially once I had children. I have 2 kids, they're grown now. But we had a couple scares. My son had a lump in his neck a couple times. It was just like a swollen lymph node, or it was, but it scared what out of me. I was, of course, I was overly sensitive to it, but I always just felt a lot of empathy towards my parents. And I was a selfish, troubled jerk in high school. And when I got sick and saw what they were going through and how tough it was on them, I always felt like it was worse for them than it was on me. So I just wanted to add that. As far as the why me, Kelly, yeah, I would say from a spiritual standpoint, I think I was in denial at first. I was upset I wasn't going to be able to drink and party anymore, and my social life was going to change. And that's certainly not where my head should have been and where my priorities should have been, but it's where I was in life. And then I think I just started getting angry. And I think it could be anything you've been through, right? I think most people probably at some point in their life have said, why me? And for me, I directed that at God. And it was kind of ironic because in high school, I grew up Catholic and grew up with religion, but was never overly religious. And in high school, I didn't really go to church, didn't pray much. And then, it's kind of like I had the gall to get mad at God when, I had no relationship with God. But yeah, the why me, I did that a lot. And then, during the course of that year, I would try to keep a positive attitude and would try to look at the glass half full. Very difficult when you're going through something like I did or what y'all went through. But there were definitely a lot of moments where I was having a bad day or I was sick or feeling the side effects or sores in my mouth or my hair falling out in the shower. I would always go back to why me. I almost called my book Why Me, but there were too many books out there by the same name. But yeah, I think a lot of people have asked that, right? I mean, even if you get into a bad car accident, you could be like, why me? and you get
Yeah.
angry at God, and there's never really an answer for that. So yeah, I did a lot of that. I try not to do it now, regardless of what's going on in my life. I try not to do that because I feel like, I've been blessed in many ways. And sure, there's other people who maybe curtains is the worst thing in their life, but most people are going to experience something pretty traumatic in their life at some point or another. So I try to focus on the positives and feel like I am blessed in many ways.
I will say that that is something that I learned in this experience. When you start opening up and sharing your journey and things you've been with, I've met a lot of people who have gone through a lot of dark things. I've had a lot of people that I didn't realize would say, "Oh, I lost my child, car accident, cancer, whatever," or, "Oh yeah," older people who you're like, "I didn't know because I didn't know your child back then years ago." You meet a lot of people and you realize that there's a lot of people that have gone through some really heavy things. And when you talked about religion, that's something else that I feel like is there's no wrong answer. I recently met with a mom who lost her child. We were in treatment together, and I just took a trip for ASCO to Chicago, and I met up with a good friend of mine whose daughter passed away. And she talked a lot about that. They were very religious, and it's been a really hard thing for them because, a lot of people will say, "Oh, praise be to God when your child survives." And it was all the thoughts and prayers. And then I think Tiffany and I have had a deep conversation about this. It doesn't feel fair to the person who lost their child. We prayed too, we were hard too. So whether, you shy away for a bit or you change your perspective, I don't think there's any wrong answer there either. I think grief is very difficult. And so I don't think it's fair for people to say, this is the best thing for you to do in this moment, maybe for that person, but
Yeah.
One thing I've learned through this process, and I've been in grief counseling since 6 weeks after Nora died. I've taken a very proactive approach to grief. Went through class called Grief Share, which is a Christian-based grief group, and they go through a book. And one of the chapters that really stuck out to me the most was and for those of you who know anything about the Bible, the book of Job, he has a lot of struggles and he is mad at God. And the whole chapter was like, God can handle your anger. And so just know, like, for all my Christians who are out there, like, God can handle your anger. He's okay that you're mad at him. Like, he gets it. We're human, and he made us this way to have these human emotions, and that's okay, and he can take that. And so it's okay to be mad, and it's okay to be angry, and it's okay to question things. But at the end of the day, I have to remind myself, like, my questions don't really have an end. And so that's what I try to keep in the back of my mind. I'm not going to get an answer to my questions that I have. And so I try, if I have those fleeting thoughts, to kind of push those to the side and be like, you're not going to get an answer to this. So there's no sense in sitting here stewing on it or continuing to make myself crazy about, well, what if this or what if that. So, but and that's why I share so much about my personal grief journey so publicly, is just so that people feel heard and understood and like they're not alone, because everybody grieving either Kelly a normal life that your daughter should have had without chemo, Steve's having to live through it, or me who's having to navigate life without a loved one. It's all normal. Everybody thinks these things and everybody goes through these thoughts and questions. And so you're not alone. We all feel that way, whether or not people want to admit that or not is the biggest thing.
yeah, absolutely.
Yeah.
And I
My
think go ahead, Steve.
I was just going to say, to your point, Kelly, about people all reacting different ways. My mom was the oldest of three girls, and within 2, 3 years, maybe 4 years after I finished my chemo, both her sisters passed away from cancer. One pretty quick, and the other one over a couple years. And I think my mom reacted differently. She got mad at God like I did, but she never, like, I think she's come back around a little bit, but for decades she was just, angry, and I think it kind of pushed her away from God. So yeah, to your point, everybody handles that quite differently.
And I don't think there's a right or a wrong. I really think that we're all just people doing the best we can. Another topic I wanted to touch on, because I think it's a big one, and I get this question a lot from families who reach out to me. How do you deal with the anxiety, the level of anxiety after your child's diagnosed, whether you lose your child and you have another sibling at home, or whether you went through it yourself as a patient, or whether you're a mom whose child survived and made it, but every day you're looking at them waiting to see if the cancer is going to return or something's going to happen. And people ask me that question a lot, from a health navigator standpoint, but also just from a personal standpoint. And I always tell them, I don't know. I take it day by day. I'm not always perfect with it. I like to share this story personally. I definitely look at things different. I think I've always been a slightly anxious person. But now that my child was diagnosed with a tumor that supposedly affects like 10 infants a year, it's hard. Like, she got a stomach virus a couple years back, and I actually took her to the ER because she was a little lethargic. And I said, should we do an MRI? I know she just had one like a couple months ago and it was clear, but she's not acting herself. And I'll never forget, the ER doctor looked at me and said, based on her symptoms, I think it's okay to assume that this is just a tummy bug and we have to give it some time. And I looked at him and I said, I lost the ability to assume the best when my child was diagnosed with stage 4 brain cancer in 2020. I said, well, I'm not assuming anything. You can take a stool sample and test for norovirus, or you can do an MRI. I prefer the first one because it's less invasive. Let's go ahead. And sure enough, he's like, yes, ma'am. He took the stool sample. It came back the tummy bug, and I couldn't have been any more happy about a stomach virus in my life, because I thought maybe it's the tumor returning. That's, for those of you who have heard my story, that's how her symptoms started. We thought she had a stomach virus because she was vomiting profusely as a baby. So that hit hard for me. And I've done the same with my other child. When Bailey gets sick, one time she had, like you said, Steve, a swollen lymph node. Her whole neck was out to here. I immediately ran her to the pediatrician. Had I not been a cancer mom, I don't know that I would have. Years ago, as a nurse, I would have been like, yeah, that's a swollen lymph node. Let's put a warm compress on it and check it again in a few hours type thing. But as a cancer parent, that anxiety, sadly, you learn, it gets better over time. You learn how to manage it the best you can, but I don't think it really ever leaves you. I'd love to hear your experience, Steve, from going through it yourself. And then, of course, Tiffany as well.
Yeah, I'm 38. I just basically hit 38 years since I was told your cancer's gone. And yeah, I still get anxiety over going every physical, any blood test, anything. I did have a couple scares, because I think most cancers, at least y'all would know this, but once you finish treatment, it's usually a 5-year period where you're in remission. And so they had told me that you're in remission, and after the 5 years, your chances of the cancer coming back are pretty much the same as anybody else. And so there were a couple times I was off at college. There were a couple times I had a scare, swollen lymph node myself. My parents would come pick me up. But I would say I'm the last person to give advice on anxiety, because I do struggle with it. The way that I do try to handle it is, when I was going through treatment, my mom had found this book. It's called Getting Well Again, and it's a great book. I think it went through a revision a few years ago, but it was a doctor, his wife, I think a psychologist. They wrote this book, and it was all around kind of the mental part of getting sick and then getting well. And it was, for me, it was an eye opener, because I believe that I did a lot of my behaviors and actions in the couple of years leading up to cancer probably contributed to me getting cancer, because of the stuff I was doing, the stress I was creating, the poor relationship with my family, and things that I was bringing it on myself. But that book really, I think, brought to me, like, stress and anxiety is just not good for your health. Again, I say that I struggle with it. I take medication for it, but I do always try to remind myself, like, sweating the small stuff is just not good. And so I say that, but it's easier said than done. But I've read that book a couple times, and it's always a good reminder for me that, not to worry, or try not to worry about stuff that, I think 90% of the stuff I've worried about in my life never happens. So, but I still worry. So there's no magical answer for it. But I think knowing how it affects your health has made me try to consciously,
You just
reduce
work
that.
on it day to day,
Yeah.
basically. It's just a constant work in progress.
Yeah, exactly.
I don't necessarily worry all the time about like Zane getting cancer, or, I mean, obviously, Nora's passed away, and, somebody will say something about, well, statistically, I'm like, well, statistically, Nora had less than a billion out of one chance that she would get ETMR, but she got it. So statistics don't mean a whole lot to me. It only matters which side of the statistics you're on, right? So it's like, you never know. So I can't say really that I have a lot of anxiety about it coming back. I mean, I did change careers fully, whether that was conscious or unconscious decision, from trying to decrease anxiety, which obviously it did decrease some because I'm not constantly surrounded by cancer patients. However, my job is in sales, but also sell oncology tests. So it is somewhat of a thought process, but I'm not day in and day out staring at people who have active cancer diagnosis who are fighting for their lives. And I'm still trying to like help them in some way, just in a different side of that now that doesn't put so much stress on a person. I mean, I actually was in clinic one day and just realized like how high stress that environment is all day long. It's like this constant, somebody needs this, somebody needs that, this person's having a reaction, this person's having these side effects, and like you're trying to constantly manage all of that. So I do try to definitely decrease stress levels and anxiety from, and I have a bad habit of staying busy. Busyness is my coping mechanism. So I've always been a busy person, but it definitely keeps me distracted from having anxious thoughts. So sitting around and thinking about the what ifs and could have beens and wondering if somebody else is going to get cancer is just not healthy, obviously. So I call it healthy distractions, even though I don't know if it's a little a little overzealous of things that I do, but
You're
you know,
excessively busy, but it's all right. We love you for
okay.
it.
But yeah, thank you guys so much for jumping on today, for listening to us talk a little bit about feelings and emotions in regards to pediatric cancer. And I hope that you guys have gained some perspectives from all three of us who have definitely been hit with pediatric cancer in different ways, but I feel like our emotions are kind of all similar in how we've lived and dealt with all of this. So if you guys have any questions or comments, I'm going to link all of our contact info below. If you want to read Steve's book, Great Fruit, we'll link that below as well, and how to get in contact with him if you want to talk to him further. And thank you, Steve, for joining me and Kelly today. And if you want to donate or get involved, you can go to goldribbon-kids.org or nationalpcf.org. See you guys soon.
Thank you.
Yeah.